So actually, so the carcinomas now would be an important topic, and essentially we know there is any comprehensive advantages in those areas. So what would be the role and the effect of FUAS? And you see here the title is Physics and Biologic Effect, and it may not be the expert field for clinician. Well, I may not be very an expert in explaining physics. However, from clinician's perspective, I would like to share more with you about a HIFU. So we need a seamless integration of doctors with their tools. We need to understand those tools in a precise way. So ultrasound, we need to understand what is a ultrasound wave. So that means a sound waves that exceed beyond the normal hearing ranges of humans. The application of ultrasound being very wide in the daily life. In our daily life and also cosmetics and plastic surgeries and etc. You would and also some ultrasonic treatment for aesthetic beauty is available. So there are ultrasonic and ablations and thermal therapy, etc. So today we will focus on thermal therapy. As we know, there is a law about the balance and energy, and you'll see the transducers would transfer energy, transfer electricities and powers into heat. So here is a tool that is used for HIFU focused ultrasound tumor therapeutic system. It is a real-time monitoring system.
And about the energy converter for the HIFU, there's another equipment device which is called which is this one, and according to the size of the lesion and the mechanism of disease, we will just use different energy converter. Okay. Well, speaking of the ultrasound, we need to understand the definitions of what is the first frequency, second is acoustic power output, the third is the acoustic intensity. And we would like to talk about the high intention, the focused ultrasound. That means the high intention. The acoustic intention has determined the effect of the treatment. And today, we're going to know that there are two kinds of the ultrasound waves, which is about the guidance of the ultrasound. The first is the planary, the acoustic ultrasound. The second is the focused ultrasound. For focused ultrasound, the mechanism is the simple. That is about the converging the low energy ultrasound to the point and form a high energy focal point, and this temperature of a focal point will just increase to the 65 to 100 degrees rapidly. It will cause the coagulant necrosis of the lesion. Okay, all of you are the clinicians and surgeons, so the ultrasound will be firstly adopted during the diagnosis. So with the guidelines, with the aid of the ultrasound, we will just decide whether to do the surgery or the medication. So the ultrasound could just help us to understand the lesion, and however, the transmission of the ultrasound waves needs the media, and will just undertake the reflection or the absorption or the reduction of the energy. And clinically, and when we just look at the ultrasound, the diagnostic report, we will see that where is the biggest myoma, where is the biggest the lesion. But when we're looking at the ultrasound image, we got a headache because the ultrasound image is a black-white image, and the color is determined by the density of the tissue, and so the image we can see is the black-white image. We like to refer it to as the echo, and so but today we will not talk about details of this. And here we can see this is the ultrasound diagnosis on liver, on the thyroid, on the kidney, or heart, and the gallbladder, and the uterus. And so let's take a look at the development history of the USgFUS. And this, although the technology is originally created in China, but this concept is proposed by the foreign scholars. In 1917, the foreign scholars have discovered that the focused ultrasound could just rapidly kill the fish in the water and will cause the feeling pain. And since 1963, it has been used to just cure the Parkinson's disease, and most of the ultrasound research is about the treatment of the disease in the brain. And when the ultrasound wave is transmitting due to different characters of the tissue, it will just cause different acoustic effect, and the tissue of everybody is different. So the ultrasound wave will just go through different tissues. In 1988, Dr. Wang started to just focus on the research of the ultrasound wave as the kind of the surgery too, and in 1997 they have finished the first the bone cancer FUAS, the clinical surgery, and in China we just focus on the clinical demand and the clinical outcome, and finally get the high precision, accurate accuracies of the lesion. So we can just put the different variant into the black box, and then we can just finally get the clinical use of the HIFU, and the energy converter will just transmit or emit the ultrasound waves, and causing the temperature increase of this glass. You can see that when our just hand is being put under the glass, it means that the hand will not be harmed, will not be injured. That means the ultrasound wave will only just rise the temperature at the focal point. And you can see that the energy converter, which is a knife of the HIFU, it can be moved freely, and so I can just cast the focal point very precisely, and also it will just move according to the shape of the lesion, and so it has given us a high level of the freedom of the moving. So you can see that through this kind of automatic control process, we can just use the energy converter to write these two characters of China. And so you can see that with this highly precise automatic control, how could we just accurate this the lesion, and you can see that we can not see that this is the ox liver, and we just use the energy converter to just write this to the Chinese characters, China. So you can see that they're completely the same. That is the characteristic of this technology. It is highly precise and can just move freely. And there are three mechanisms determining that the ultrasound could be so highly precise. And the first, it will just have the mechanical effect. It will just cause the mechanical friction and the mechanical vibration. This kind of mechanical effect will just increase the temperature. Second is the thermal, and the third is the cavity effect. It would just accelerate the absorption of the heat in the tissue, causing the temperature increase, and also instantaneous cavity will just give off the impact wave, which will just directly destroy the tissue. And so the cavity effect has the two kind of cavity. First is the static cavity. Second is the instantaneous cavity. We will not talk about the video. And you can see that this cavity effect will cause the changes in the gray level. You can see that when the tissue has undergone the coagulant, the necrosis, it will just cause the change of the gray level. And second, it will just create a lot of the bubbles. This will also just increase the gray level of the image. You can see this is obvious on this image. You can see that the coagulant, the necrosis of the tissue is obvious. And although a lot of the equipment is referred to as called the HIFU, but they're different. And the first is the kind of the HIFU is the focused ultrasound, the thermal ablation. Second is the focused ultrasound thermal treatment. So for the first one, it could just conduct the one-off treatment and also just realize the local eradication of the lesion, and it is the convenient for the conformal ablation treatment. And also we can see that for the second kind of the ultrasound, which is the ultrasound thermal treatment, it can just finish the multiple times of the treatment. And it is suitable for the palliative therapy or the auxiliary therapy, and it's also suitable for the non-conformal treatment. And during this treatment, it will cause the irreversible coagulant necrosis of the cells, and this kind of the necrosis. And this kind of the focal point is not so sharp as the intensiveness is lower. And for these two pictures, we can see these two pictures are from the same patient. The first one, it is the HIFU. After the HIFU surgery, we can see most of the lesion is there. And in the middle, we can see this is there is some increase of the echo. But after the thermal ablation, we can see that there's no infusion So these two different approaches can just lead to different outcomes. And last year, the Li Jiacheng just invested a lot of the US dollars and on the HIFO knives, and let's see that the mainstream of the HIFO is focused on the thermal effect, and the thermal effect can be just presented, can be very highly precise, and you can see that this is there are only 5 to 6 cell sets between the necrosis and the normal tissues, and the bubbles will also fracture the cell structure. It will not cause the coagulant, the necrosis. It's like the mixing the juice. It's like the melting the tissue and mixing it in the solution, and so it will realize the higher precision control of the timing of the power output, and we can just control the size of the focal point. Focal area. And in case of the conformal ablation, we can realize the complete ablation of the lesion, and also during the linear ablation and the planetary ablation, it is also very highly precise. So you can see that during this is the process of cavity process, and also you can see this is a liquidation of the tissue. Some of the tissue will be liquidized and will just flow out, and the last one is about the boiling of the tissue. We will not talk about it. And about the cavity of the tissue, we can see that with the cavity of the effect of the HIFO, we can just very effectively control the growth of the cancer. I want to cite an example. When we're going to beat the juice, no matter how long you just extract the juice, there are also the residual of the fruit flesh. So here is the same. During the HIFO, there will be the residual residue of the cells in this lesion. So clinically, we need to refer to the demand of the clinical operation, and finally determine which modality we need to resort to. In our system, there are the HIFOs focusing on the cavity effect, or focusing on the thermal effect, or we can just combine the different modalities together. So I'm just talking about the mechanism of this effect, but it is about how we can just recombine the different modality and effects of this mechanism to reach the best results.
Now, clinically, during application, how can we have a better control of a HIFO? Just as you mentioned, just like I mentioned, that there is a biological focal region. So energies that will lead to a size of region, an area that would have coagulative necrosis. So we will have a combination of dots, lines, slice, volume. Now, Dr. Wan's team has also put forward a concept of an energy efficiency factor So that includes a combination of a dot line, slice, and volume. So can we get a formula that can let us know how many energies we need to use? We're now working on it, and we are also developing AI and agents and are trying to have better analysis results. Well, since it's quite complex and in the tissue environment, and so different factors would have an impact on the result of performance. And this is the acoustic focal area. So under different circumstances, and the focal region size is variable. Actually, so this kind of coagulative necrosis, and it would be showed in a way of a grayscale. So by MRI, we can check temperature. So those are this shows on after dying. And this is a uterus, and you can see the coagulative necrosis, and so you'll see it's dry, so it's not liquefied. And so for the operation room, it is a non-invasive. You just need a room of this kind to complete a whole process. Well, clinically, first, it's ultrasound guided. According to the change of a gray scale, here it shows a mass, and that indicates a coagulative necrosis. And this is an experiment that we did. So once it's stable, with no further expansion of a gray scale, you can have a look at the shape here. Actually, along the margin, so there's you can see the gray scale change, and it is consistent with the tissue that we dissected and with the sample we took. So here we need to observe the location of the focal point, and then we need to understand the safety of the acoustic pathway or passage. You can see there are mass and tissue necrosis, and then we move further after treatment, or intraoperatively, you'll see there's a change of a gray scale. So you'll see there's a mass change, and due to cavitation and also necrosis. Well, as for specific mechanisms, and we will explain you in details and in Chongqing's training. Then we use an ultrasound contrast agent. You can see there's a black cavity in the middle, and after treatment, you see it's absorbed gradually and then shrinked. So what are the risks during treatment? And I was hearing some discussions previously. There's so those cavitation during the process, and as we know, actually in China, the C-section happens very frequently. We need comprehensive solutions to assess a scar of the skin, and we would use skin preparations and sedation and analgesia during treatment, and we also have an intestinal risk that we need to control. So there are a lot of intestines in the front side. In order to guarantee the safety, we would need a series of preparation. So the goal is to push those intestines surgical preparations and intrasurgical observations, etc. So there are different absorption ratio of different tissues, and so the nerves are very sensitive and not only to ultrasonic power but also to different different approaches, and therefore we need to be very cautious about nerve injury, and this can be avoided. Now, how can we have a good control of a HIFU knife? And Dr. Ali and also other experts have been working in this field for many years. And as we know, there are several points that will have an impact. First of all, that is the treatment and intensity. So with a longer intensity and treatment time, so BFR gets bigger or higher. And here, this is an CZF. While with time passing by, ultrasound power would get closer to the source of the sound, and then with increase of energy, it's easier to disseminate to the front side. So at 144 seconds, there is a coagulative necrosis. When it reaches 149 seconds, the mass gray scale is disseminating towards skin where the source lies in. So this is very closely related with what we observe in the imaging. So gradually it moves towards the source, and also these are the treatment depths. Is another point. Additionally, you see under same irradiations and the different depths of radiation with the increasing of radiation depths, and you'll see the necrosis are different. Therefore, in clinical application, we can see tumor. If tumor located deeper, then you need higher energy to treat it. So this is here takes us 73 seconds, and while you see in the second patients, the depth is very deep, and while also with a low signal. Therefore, the treatment was 802 seconds. While those are the factors, and it shows different organs here, liver, kidney, and muscle. It shows the energy needed for single unit of areas are different. While blood flow also have an impact on powers. So sarcomas requires a different power density. You can also see here is the oxytocin is used to decrease blood supply. For those who have needs for scientific research, here is those theories and help you to do better calculation. And this is a EF. Well, actually, in the treatment, we would use different approaches. For uterus, we can use different approaches such as exotoxin, and then for liver, when there is a sufficient blood supply, then I can block certain block a blood supply in certain areas, or we can use some micro bubbles or water-free methanol, etc. So everything is in the purpose of treating patients properly. So here, this is an with and without an effect and enhancer. We can also look through it in another time. So now this shows the development of medicine in these areas from open surgery to minimally invasive to non-invasive approach. And there's a lot of progress. I welcome you to discuss with us more in Chongqing. Thank you very much.